Hi, I'm Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Today, I'm happy to be joined by Dr. James Gough, Chief Executive of the David Nott Foundation, a London-based organization that has trained thousands of surgeons and medical teams to save lives in war zones and other challenging environments. The foundation, created by trauma surgeon Dr. David Nott and his wife Ellie, equips frontline clinicians with the skills and confidence to operate under extraordinary conditions. Before his current role, Dr. Gough served as a doctor with the British Army and humanitarian groups around the world. Since leaving medicine, he's combined that field experience with passion for technology and diplomacy. From designing virtual reality trauma simulations in Syria and Yemen to using AI to track illegal weapons in Africa. Thank you so much for joining us today.
Thank you for having me.
So with all of our guests, we like to find out about their background and what got them interested in medicine. Can you share that story with us?
Yeah, sure. It's actually a very traditional story in the sense that my mum was a nurse and my dad was a family doctor. And perhaps through a privilege, really, to be able to just think, oh, well, I therefore can think about medicine as part of my future. I mean, it's not something everyone can think about, it being a sort of seamless transition from school into medical school. But I read a book when I was about 16. I guess going back a bit, I wasn't that excited about medicine. So it was not like this is my calling and I'm going to do it. But it had always been around, even at the age of 9 years old, 10 years old, we were taking calls through to our house on behalf of Dad, who was on call, and then paging him, the pre-cell phone days, and trying to get him connected to his patients, so that it was always in and around the house. But it didn't I guess it just didn't light my fire particularly. But I then read a book when I was about 16 called Knife Edge by a special forces doctor. And I guess quite an impressionable age, I just thought, this sounds awesome. I would like to be a special forces doctor. And so then that was fairly fixed in my mind. And then the next 10, 11 years were fairly formulaic in that regard. I went to medical school, did my junior residency. So here in the UK, we do what's called F1 and F2, so 2 foundation years after medical school. And then we specialize, or in my case, went off to the military. So where I went to Sandhurst, sort of our equivalent of West Point, did the necessary officer training before some military medical training. So in that respect, it was, I had a kind of different mission. I wanted to do the special forces doctoring, and then I wanted to transition into humanitarian once I'd done my time in the military. It didn't all pan out like that, but that was the background of what was intended.
That's a really great story. So you kind of grew up around medicine, a family of providers.
Yeah.
You're inspired by that book that you mentioned, Knife Edge. And I want to kind of talk a little bit more about you starting your career as a military doctor. What moments or experiences from those early deployments have had the greatest impact on shaping who you are today and the direction that your career kind of ultimately took?
Well, I guess this is where it slightly derails. So this is where the story kind of doesn't go as it went in the book that I read. I actually, as soon as I got to the military, I realized I'd made a terrible mistake. And I just was like, I didn't realize I wanted my freedom as much as I do. And so you learn a lot about yourself, obviously, in those first few years as a professional. And in the UK, you can sign up to the military while you're in medical school. They can sponsor some of your studies. I think they sponsored 3 years of mine. You basically sign up for 6 years return of service. And at that time, I was absolutely committed to that. So it didn't even seem a hard thing to do. But then fast forward, getting my degree, spending a couple of years as a doctor working in normal NHS hospitals here, that taste of freedom and professional life and thinking, I could go anywhere. Then to be told, no, you're going to a military academy and you're going to go and basically be told what to do, felt abrupt. And so I suddenly thought, oh my goodness, this is not what I want to do. However, I'd committed to 6 years, and I always say that the saving grace was that I didn't in the end get attached to the Special Forces unit, because the Special Forces it's more relaxed. It's not so military in the kind of quintessential stereotype. It's first name terms. It feels a little freer than perhaps it might otherwise. And so I did some really interesting things with them, not always overseas, both here in the UK and overseas exercises. And then I got deployed to Afghanistan in 2012. And then within 3 weeks was actually injured in a blast, and then fractured my neck and shoulder burns and various different nerve injuries. So then as a doctor, found myself as the patient and medevaced back to the UK via Camp Bastion. And so it was an incredibly abrupt end to what was, as I said, was a kind of story that I'd read at 16, and then at 26, 27, it just didn't end well. And that was, really, that was the end of my military career, because it took the shine off things. I had a year in rehab and started to think about the freedom that I actually did yearn for.
Absolutely. Thank you for giving us that window into your early career and kind of those challenges that you went through during your career as a military doctor. So you come back to the UK, you're recovering. What happens next?
Chaos. I think I joined the Foreign Office, so State Department in US language, as a diplomat, which was a really fortuitous opportunity for me. And however, I had a good 3 years, I guess, what I wouldn't have recognized at the time, but the indecision, the anxiety around my injury, post-injury period, I guess it's PTSD or whatever we call it. But I had a fairly turbulent 3 years of making some relatively poor career choices and even poor personal choices. It delayed my engagement, all these kinds of things that just, you're just not, I wasn't in a particularly good spot from 2012 to 2015. And then after that, just suddenly a few strong words from a couple of close friends to just get my act together, and having left the Foreign Office, I joined a really interesting startup in 2015, which was a cloud-based surgical guidance company, really kind of completely nothing to do with my background and what I'd been into. But I joined the commercial team of that organization. It was a Cambridge UK-based company doing live guidance in the operating theatre, kind of a sat-nav for surgeons, very kind of early days, in terms of machine learning and machine vision. So really exciting. But spent 3 years there, I guess, kind of stabilizing myself, opening a whole new world of things, which was my first foray into technology. So although I'm a tech file, I'm not a techie. So I would never have described myself as a techie. And so it was cool, because suddenly I was like, wow, there's some interesting stuff going on out here. And then over that period of time, 3 years there, started to think, okay, well, if this cloud thing can do this in the operating room with machine vision in a developed country, what can it do? What can this kind of technology do in the places that I love to go to, love to be a part of, and the kind of internal mission that I have around conflict and catastrophe. So then that I guess starts to plant a few seeds of like, wow, what can happen in this world that I've now been exposed to unintentionally.
So just to play that back, from like chaos and some challenges to stabilization, kind of opened your eyes up to the possibilities of what could be achieved, brings us to the David Nott Foundation, where you are today. For listeners who might be unfamiliar, can you give us a brief description of the David Nott Foundation and what it's all about?
Yeah, I understand also in the US it might be kind of a misleading name. The David Nott Foundation is an NGO. So it's in the field, and we work in the field. So the David Nott Foundation, I've been CEO now for nearly 18 months. So I'm very new in its decade of history. David Nott, if listeners aren't familiar, if you go on ChatGPT and say who's the greatest war surgeon, it'll come up David Nott. So he's a very well-known, well-regarded war doctor. He's had 30, 40 years in the field, visiting most conflict zones that we've heard of, and has over that period built up an incredible library of experiences. The thing that makes him, there are other war doctors out there, but the thing that makes him different is he's obviously extraordinary at what he does, but also he's documented what he's done. So he's written it down, he's taken photos, he's videoed, and over that period has collected so much information that back in 2015, him and his wife Ellie, I think it was his wife Ellie really that was saying to him, look, the world needs this knowledge. There is no training pathway for a war doctor. You can't go to med school and say, I'm going to specialize as a war doctor. You can do trauma, but that is not war doctoring. It's completely different. So the foundation then set about creating a course and training any surgeon initially, what we call our HEST course, which is Hostile Environment Surgical Training. Any surgeon we can take them through this 5-day course. And it's essentially what David likes to say is 30 years of experience in 5 days. And here are the 45 to 50 operations you need to know from head to toe if you find yourself as the only surgeon in a department, whether you've got to do gynecological emergency or a neuro emergency or an orthopedic emergency, whatever kind of surgeon you are, if you've got the principles, this is what you can do, and you can save a lot of lives doing it. So our day-to-day, and I'm sitting here in our office, you can see our logistics sort of hub behind, which is where all our med kit is. Our day-to-day is deploying to conflict zones to train doctors on the front line with the skills they need to be war doctors. Now, 10 years later, we now do that for surgeons, we do it for obstetricians, and we do it for anesthetists. So we have 3 different courses for those 3 different types of doctor. And so we take it to the country. So we're currently in Ukraine, in Syria, and in Palestine on a regular basis. But also we do deploy to other countries when it makes sense, when we can get there, when it's safe, and all those kinds of things. We also have biannual cadaveric course here in the UK at the Royal College of Surgeons of Edinburgh, where we host doctors from all around the world. We've had lots of doctors from the US and from as far-flung as Taiwan, Australia, Singapore. They come to see us in Edinburgh, and we take them through a 5-day cadaveric course. Same course that we deploy with, but overseas we use synthetic materials, so prosthetic hearts, prosthetic bowels, that kind of thing. Whereas in the UK we use cadavers, and so it's a slightly more realistic course in that respect. And so that's our kind of main product, if you like. But in and around the NGO, obviously we've got lots of other things going on. But I guess that's a decent brief of what we do as a foundation.
Yeah, incredible. So let's talk a little bit about the virtual reality trauma simulations that I believe you've used in various locations. And I want to talk about the technology that made that possible.
Well, so after I'd done that fairly peacetime startup experience in Cambridge for the 3 years, that's when I started to think, what could we do with technology? And I wanted to kind of, quote unquote, go back to my roots a bit. And so I started a company called One Shot Immersive. And the idea was that we could build virtual reality experiences for combat, for trauma training, not of doctors. My primary target at that time was all of us, because when I was injured, it was a non-medic that helped me and evacuated me, and basic principles of trauma emergencies. And if you walk out onto the street, certainly here in the UK, you might find a few people that can do CPR, but you're very unlikely to find anyone who can do CABC, trauma response. So, if you suddenly find yourself in a blast, or someone's, lost a leg or is bleeding out, I know in the US you have Stop the Bleed, and that's quite a big campaign, but here it's not well known. So it was how do we get virtual reality to the masses, not just in civilian street, but also in the military and NGOs. And so that's where VR and virtual reality really lends itself is to those difficult topics. They're difficult to simulate, they're expensive to simulate, and they're ethically challenging to simulate. So take a chemical attack on women, children, and a population. How do you simulate that without spending an extraordinary amount of money and terrifying everyone? You can do it in a virtual world. You can create these horrendous situations that you just need to train for. So we created our first product was a mass casualty triage event. So initially it was training someone to do the very basics and stop the bleed. And then the second bit was training a triage officer to sort between those who might survive and those who might not survive. And so sort of distributing your resources accordingly. So that's where VR works. It works for situations with jeopardy and trying to put people under pressure in a safe space without spending an extraordinary amount of money. So that was the kind of idea, and we launched it in Yemen, and I did some field testing in Syria or Turkey, Syrian border, and then we launched it first in Yemen. And that's how I came across David Nott Foundation, because they were the innovators that said, hey, let's work with you on this product and let's take it to the field.
So that must have been kind of a full circle moment for you, creating kind of that virtual reality for trauma training for mass use. Then you move on to the foundation. I want to talk a little bit about the most significant outcomes that you've seen from the foundation's training programs thus far.
Well, so, yeah, I was thinking about this question because there's, for us here, we can say, we've trained nearly 2,400 doctors in Ukraine. It's over 750 now. And we can also measure how many patients they might be seeing on a daily basis and infer from that how many people might be getting better outcomes. And so I could tell you about the data, which might be a little dull, but actually the qualitative data that we get back is the bit that sort of keeps. In fact, I screenshotted one today and sent it to the team, just because that feedback we get from the field, from the front line, is really powerful. So we did our cadaveric course, the one that happened last December. We had 3 Ukrainian surgeons. We sponsor surgeons from different conflict zones to come to that course. And we'd sponsored 3 Ukrainian surgeons to come over. And not 3 days later, we had a WhatsApp from one of the surgeons saying, I just had a mass casualty event. I would never have known what to do. I had 4 casualties at the same time and they all survived. Thank you. So I think I could give you some data, but that's an unbelievable outcome. And assuming if you train one person really well, it's a kind of one-to-many approach. They then teach their residents. They tell them about the different technique that they then learned. And so it's a scalable model in that respect.
That's a really powerful story with that trickle effect, and just kind of reemphasizes how important the work is that you guys are doing and also how rewarding it is. As a McCain Institute Global Leadership Fellow, you've worked across government, NGO, and corporate sectors, all very different. But what do you see as each sector's greatest strength and limitation in driving change?
Yeah, I enjoy this question because I think about it a lot because, of course, I find myself, whichever sector I'm currently working in, I'm quite critical of it. So I almost become, once I'm inside the tent, I then start thinking, right, this has got all sorts of failures and we need to sort of learn from the other sectors. I mean, ultimately, they're all flawed in their own ways. And that's critical to understand. And they all need each other. But I did make I did think about what I think about my experience. And it might sound a bit pithy, but in a kind of summary, with government, you get this extraordinary access and extraordinary reach. You can go anywhere. Even as a special forces unit, we had unbelievable access, and there was really very little that could limit us in terms of where we wanted to go and who we wanted to speak to. The big problem is that government blocks creativity. So however you look at that, that's a real problem. With NGOs, and this is my first job working in the sector, I did do medical deployments as a doctor, but this is the first time I've sort of been in the tent properly trying to work the sector out. You get a very good understanding of context. So I was in Palestine in the summer. I could speak to people properly. I wasn't going around in an armored vehicle or some diplomatic movement. I was just genuinely talking to the doctors there on the ground. And generally you're mission focused. So you really are quite specific on one thing. I mean, at the David Nott Foundation, we stay in our lane. We do this thing. We know we're good at it. Of all the sectors, I think this is the one that understands the other sectors the least. And there is a reticence to even learn or engage. So I feel, particularly with the corporate world, I think the sector needs to do a better job, the NGO, the charity sector. With the corporates, the appetite for risk is there, the vision for change. I would say there's a lot of, it's those visionaries within those organizations, and you're constantly thinking about innovating, failing, moving on, and doing the next thing. And it sounds obvious, but it's true. The problem is the drivers are wrong. So you can't achieve impact if your driver is profit. You can get profit through doing the right thing. That's not what I'm saying, and it's absolutely fine to seek profit. But if that's it, the drivers will be misaligned somewhere in there. And so that can be quite frustrating if you're trying to do something interesting or work with an organization that you think might yield bigger change and bigger impact. So that's something I struggled with in the corporate sector.
That's a really thoughtful breakdown. I want to talk a little bit about Osmosis. As you know, we're a teaching company. We love to fill knowledge gaps. And I wanted to ask you if there's a topic you think Osmosis should make a video about to fill a gap that is of particular concern or interest to you.
Yeah, I mean, I would say this, wouldn't I? But I think there could be a way of medical students and young doctors access it, and in fact, let's not limit it to doctors, the healthcare professionals having more access to how do I, in my profession, prepare for a situation where I might be the only one. Because we're in a world, there's 110 conflicts today. The world is incredibly unstable. I think if we were talking 10 years ago, you're in the US and I'm in the UK, this would have seemed a little bit sensational, me saying that. But actually now I think we can both agree that the world is a very volatile place. And yet the healthcare staff in the hospitals, even here in London, are not prepared for a conflict or to be the only person, the only healthcare worker in that situation, the only surgeon, the only nurse. So for me, it might not be able to be captured in one video, but preparedness and just educating the context within which you might find yourself, like an austere environment, let's say, where your resources are spread, that I think would be an excellent way to empower medical students and young healthcare workers.
That's a really good topic. Thank you for sharing that with us. We're always thinking about kind of new topics for our content team to pass along to them. In our audience, we do have many students and early career health professionals. For those interested in serving in a crisis setting, what mindset or skill set do you think would help best prepare them?
Well, I think I can only say this in hindsight because, of course, I don't think I had the right mindset pre-Afghanistan. But I do think that you have to, don't sugarcoat it. You're not going to have a world-changing impact most of the time. You're going to, and probably ever, but you are going to make small changes that feel tangible. A lot of it might feel not so tangible. You will fail probably more than you succeed, particularly as these are such complex and challenging environments. And just have that humility. I think for me, it was a real hammer blow being injured, but it was an excellent way of taking down a peg or two, a fairly arrogant young special forces doctor, and teaching them a little bit of a lesson. And so that was in large part one of the better things that happened in my life. And then just be, I guess, three things: be creative, be curious, and be resilient. The last one is hard because you never quite know when you're going to muster resilience and when you're not. But I think that would be my little nuggets.
Such valuable guidance there. I know our listeners will really appreciate hearing that from someone with your experience. To play that back, be creative, be curious, and be resilient.
Yeah.
Before we go ahead and wrap up today's episode, I wanted to give you a chance to cover anything that we didn't that maybe we should have.
I guess the one thing is that we're looking for friends in the US. We're looking for advice, and we're looking for, I guess, a way that we can bring some of our skills and expertise and share it, but also exchange it with leaders as well in the US. We'll be launching in the US in 2026. What does that mean? Both from a fundraising perspective, but also from a medical perspective. We won't necessarily be running courses in the US, but we want to engage more of the US medical community. We have a lot of US doctors coming to our course in Edinburgh, but we just think there's a huge amount. I mean, for us, it's all about knowledge exchange. And so whether in the US or whether in Ukraine, we want to be speaking to people and understanding what successes they're having, what failures they've seen. Just one example, the most experienced surgeons in the world are currently in Ukraine because of what they're facing. But that can change on a dime. So just really looking forward to landing stateside. Would love to meet anyone who's interested in the work that we're doing and to collaborate, because as I said about the three sectors, we're an NGO. We'll be failing in at least two other areas. So it's just about collaboration and connection.
That's a great call to action. And should they just go ahead and visit the website to get in touch, davidnottfoundation.com?
Yeah, they can get in touch through the website and we'd love to hear from them, or they can contact us through Substack as well.
That's awesome. Thank you so much, Dr. Gough, for being with us today. We'll certainly be following along the great work of the David Nott Foundation and can't wait to see what you guys accomplish next.
Thank you, Lindsey.
And that's a wrap on today's show. I hope you enjoyed Dr. Gough's insights and experience at the fusion of medicine, technology, and humanitarian work. The David Nott Foundation's mission is a great reminder of how skill and compassion can save lives in the most challenging circumstances. If you'd like to learn more or support their work, visit davidnottfoundation.com. I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.